Tom, thank you so much. Now, as promised, debt from medical care is skyrocketing here in the U.S. Right now, more than half of all the bills in collection come from hospital stays and procedures, and collection agencies are starting to get involved. Anna Warner breaks down the new report and shares a few ways to deal with all that debt.
Florida resident Chad Kish's medical debt story began with severe pain from herniated discs in his neck last year.
I really couldn't get out of bed for more than a few minutes.
Doctors told the 39-year-old who runs his own small pest control business that he would need surgery. So he checked to make sure his insurance would cover it, then went ahead. But afterwards, he got stuck with a bill for a facility charge he says the insurance company refused to pay, $145,000. He says the hospital then demanded payments of $1,500 a month.
I told them that can't happen. Can we go with something lower? And they said no.
When he couldn't pay, the hospital sued him.
And you're like, oh boy, now what do I do?
He's not alone. A new JAMA study finds medical bills are the largest source of American debt, with a record $140 billion in collections owed last year, nearly twice the previous estimate. It's all about the medical bills.
Yeah, it's sort of a uniquely American phenomenon.
Stanford professor Neil Mahoney, the lead author, says bills are often higher for people living in a dozen states that chose not to expand eligibility for Medicaid under the Affordable Care Act.
The fact that the healthcare system, which is supposed to heal people, is creating half of debt and collections in the United States is something that I think is quite distressing.
Back in Florida, Kish says he was able to negotiate his bill down with a self-pay discount, but is still on the hook for roughly $50,000. And now he'll be paying $125 a month until it's gone, which will take some 33 years.
Very, very frustrating.
Keep in mind that study only looked at debt that was already in collections, so it's not the entire picture. Data from the pandemic is not reflected yet. Anna Werner, CBS News, Berkeley, California.